Good morning and welcome to our COVID-19 press briefing. Today is Tuesday, October 22nd, 2021. This is Kathy Turner, Director of Communications for the Department of Public Health and Wellness. Dr. Sarah Moyer, Director of the Department of Public Health and Wellness, is your host today. Joining her are Dr. Daniel Blatt, a pediatric infectious disease physician with Norton Children's Hospital, Dr. Sarah Beth Hartledge, Associate Medical Director for the Department of Public Health and Wellness, Dr. Swanee Jett, CEO for Park Duval Family Health Centers, and Connie Mendel, Assistant Director for the Department of Public Health and Wellness. I'd like to remind everyone to please mute your devices, place your questions in the chat addressed to everyone. Thanks. Dr. Moyer, we'll turn it over to you.
Thanks, Kathy. Good to be here this morning. So Sarah Moyer, I am here hosting our now bi-weekly COVID update for Mayor Fisher today, who was not able to join us. So lots of positive news has come out over the past 2 weeks regarding vaccines. Our booster doses are now approved, and it's okay to get a different booster from the vaccine you got for your first dose. And it's also looking like we may have pediatric vaccines in the arms of 5 to 11-year-olds before Christmas. As a mom who has 3 kids in that category, I'm very excited about that. And it gives me great hope that we will be able to further protect our community and keep our kids in school this year. So we are going to go into the details on all of that with our guests today. And to kick us off, I'm going to turn it over to Dr. Sarah Beth Hartledge, our Associate Medical Director, who is going to get us started with the latest look at the COVID data in our community and our dashboard. Dr. Hartledge.
Thank you, Dr. Moyer. So I'm going to do our regular walk through the data dashboard. As you can see, we are still in the red zone for incidence rate. So we had our incidence rate is currently 27.2 new cases per 100,000 of population, with 1,459 new cases confirmed last week. We will drop from red to orange when we cross an incidence of 25. So we are inching our way back down out of the red zone, but still in the red for now. We had 8 new deaths reported last week. And if you take a look at both the graphs here, we have cases and then these are deaths on the bottom. And both of those curves you can see they really zoomed up in September, and they have slowly worked their way back down, but we are still pretty significantly higher than we were back in June and July when we were at our lowest. It's important to remember that it takes really no time for the numbers to zoom up when they're increasing, and it takes a very long time for them to slowly work their way back down after a surge. When we talk about vaccinations here in Jefferson County, we now have 57.3% of our population that has received their entire vaccine series, and over 65% of our population who's received at least 1 dose. And that puts us over 500,000 people who have received at least 1 dose of vaccine. The color-coded line graph on the right, you can see the orange dots are the first doses. And they picked back up a little bit with the Delta surge this fall. They are slowly coming back down, but we are seeing an increase in the number of boosters being given. There was new guidance this past week from the CDC that creates a large number of categories for adults who have previously been vaccinated. If you were fully vaccinated with Janssen at least 2 months ago, or if you were fully vaccinated with Pfizer or Moderna at least 6 months ago. And if you are over 18, you probably qualify for a booster in some circumstance or other. People with underlying health conditions, anyone over the age of 65, those who live in congregate settings like long-term care, or those who work in high-risk, high-exposure settings like healthcare or first responders, among many others. So lots of ways to qualify for a booster. And they're being given at many provider sites across the metro area. This is our map showing vaccination rates, and you can see we continue to have a differential from east to west side of Louisville, with the darker green representing higher vaccination rates. Our public health team and other partners continue to work hard to bring access to those with limited access, and to also bring understanding and caring and services that are sensitive to the particular needs of a community by partnering with groups that work, that live and work in those communities as well. And the last thing I'll show here is that we have our hospitalization rates are continuing to trend down, ICU and ventilator rates as well. And as I said before, it takes very little time for these numbers to climb up the charts, and then it takes a very long time for them to climb back down slowly. So we hope and believe that we are on the downside of the Delta surge, and hoping that our numbers will continue to fall as we move into the rest of the fall season. Back to you, Dr. Moyer.
Thank you, Dr. Hartledge. Few questions for you before we move on to our next guest. So as you mentioned, vaccination rates are slowly moving up across the whole community, and our COVID cases are slowly going down. So how do you feel about the coming holiday season and winter months, and what advice are you giving to friends and family?
So I'm certainly feeling a little bit of deja vu, because I remember having these conversations around the holidays last year, but I think the guidance is to be safe, be smart. I think most people should know what the right thing to do is by now. So is it safe to go out to the pumpkin patch and be outside with your family? Yes. Is it safe to go trick-or-treating? Probably so. But do you want to be in a crowded house for a Halloween party? That is going to be a higher risk situation. So it's important to get vaccinated yourself, and hopefully surround yourself with vaccinated people, your friends, your family members, your loved ones. If you can encourage them to get vaccinated as well, that's the path forward for us to being able to do all of those things safely. As you mentioned, we have pediatric vaccines on the horizon for the 5 to 11-year-old group. I also am a parent to a child in that age group, and I'm very much looking forward to getting her vaccinated before the holidays this year.
And me too, for my kids as well. So let's go over the boosters just a little bit more. I know you mentioned the broad categories. Do you mind just breaking it down one more time for our community on who qualifies for boosters and which one you think they should get today?
All right, so we'll start with the easiest one, which is that anyone over the age of 65 qualifies for a booster dose, no matter what. So that one's really easy. The next group is people who live in high-risk settings, and those would be folks primarily that live in long-term care settings like nursing homes, but also does include folks who live in correctional facilities, other institutions, things like that. Then the third group we're going to see is those who work in high risk settings, and that's our healthcare heroes, our first responders, those who work in corrections, but also people who work in food and agriculture, or postal service workers, other those essential workers that we all were so grateful to for getting us through the initial lockdown period a year ago. And then finally, we have anyone over the age of 18 with significant underlying health conditions. And this is really a very long list at this point, but if you see a doctor for anything regularly, if you take medications for anything regularly, or if you have a BMI over 25, then you probably qualify for one of these doses. The CDC, as you mentioned, also did lift the restriction on mixing doses. So if you happen to get vaccinated with Pfizer back in the spring, and you feel like you want to get vaccinated with Moderna for your booster dose, that is acceptable. You can, or the other way as well. If you got Moderna the first time around, you can get Pfizer now. For most people, that is not a significant decision. It's not something that people need to really stress over or lose sleep over. It's getting a booster dose from either is going to be perfectly acceptable and useful for most people. There may be some people with immunocompromise who may have specific issues, and they should talk to their doctors, but generally you can get booster dose at pretty much any provider. Many are serving only one vaccine at a time. So you can sign up for either one or any of their products, but you can mix them if you feel like that's important to you. And there's no longer a restriction on doing that. So if it's been 6 months since you got your vaccine, which for many of us it has, it's time to look and see if the booster is convenient and available for you, and see if you can get one for yourself leading into the holiday season.
Thank you. That was a great summary. So yeah, anyone who got vaccinated at 6 months ago was April. So April or before is due for a booster now. And if you had J&J, it's just 2 months. So that's that August. So anytime, if anyone's been vaccinated April earlier or August or earlier for J&J, look to see if you qualify for a booster. Switching directions a little bit. Oh, sorry, Dr. Hartledge, one more thing. We are offering several community vaccination sites. Can you tell us a little bit about those and what kind of vaccines we are giving at those sites?
Sure. So we have been doing LUVAC's mobile missions for many months now, and we are now performing often what we're calling a standing site. And this is a continued partnership with the Kentucky Nurses Association, where we are returning to certain sites where we've had success, and we're going back to them on a regular basis so that folks who live in these communities, and these are targeted areas, you can see on the screen that the list is always updated on our website, but we are continuing to return to these sites. They're targeted neighborhoods and areas of town where we know that access to vaccination has been limited. These vaccines, like all COVID vaccines, are free. We are happy to provide language translation services and other things that may be needed from the patient perspective, and have returned to Neighborhood House, Valley Neighborhood Place, Smoketown Wellness, La Casita, many other partners that we've been working with for the better part of a year now, and really appreciate them helping us reach into these communities and get folks vaccinated. So the website will always show you which vaccine is being offered at which site, but we at the health department do stock all 3 available products. So we do have all 3, and we do serve different vaccines at different events depending on the needs of that specific site and community.
Thank you, Dr. Hartledge. And one more reminder, we have, besides the community sites, there are over 100, I think close to 200 places now where anyone can get vaccinated. So just check out our website or vaccines.gov for that full list if you're looking for your booster, or in the coming weeks for a vaccine for your child as well. So joining me now is Dr. Daniel Blatt, a pediatric infectious disease doctor at Norton Children's Hospital, and Dr. Swani Jett, the CEO of Park Duval Community Health Center. So thank you both for joining us today. Dr. Blatt, how have you seen COVID affecting children here locally?
Well, thanks for having me today. I work for Norton Children's and the University of Louisville, and we see a lot of kids who have had COVID-19. The majority of them are outpatient, but we do have some kids who are severely sick inpatient with COVID-19. And although the numbers in the community are getting better, we're still seeing sick kids. And so it's still important to be diligent about our public health measures for sure.
Yeah, and I know the majority of the cases that we are seeing is in those younger age groups. And so that's part of the reason why we are excited about the new vaccine. And you did mention you've seen some kids hospitalized in especially in the 5 to 11 age group. Mm-hmm. How are you feeling about the new pediatric vaccine that may be coming out here in the coming weeks?
We're all really excited about it. The preliminary results, the data that Pfizer released, the review that the FDA is going to look at very soon, it all looks promising. The vaccine had for 5 to 11-year-olds had very few serious adverse events, really limited, even mild events, and really strong efficacy data. It seemed to be over 90% effective in preventing symptomatic COVID in kids who are 5 to 11 years old. And the data they put out suggested that this could prevent thousands and thousands of cases. I think they said around 30,000 cases it could prevent in kids, and it could prevent a couple hundred hospitalizations in kids. And so that's significant. And not only that, but it prevents the kids that get vaccinated are going to also prevent the spread to adults or those who are immunocompromised or those who are elderly.
I think that's probably my most exciting piece about getting my kids vaccinated is that I will have less fear of them getting my in-laws and other family members that are older that may get sick even though they're vaccinated from even getting sick in the first place. Are you hearing any concerns from parents of kids in this age group about vaccinating their children?
Yeah, I think a lot of parents have concerns about any medical intervention with their child. I think the majority of the parents that I see are very excited about the vaccine, as the doctors are as well as we are as well. And but it's okay for a parent to have a concern. Parents are really just looking out for their child and they want what's in the best interest of their family. But what's been pretty universally proven, what really large trial data has shown, is that the vaccines are very, very safe. And they're some of the safest medical interventions we have. And not only that, COVID is very dangerous, and these vaccines prevent that. And so the risk benefit of the vaccines weighs far in favor of the benefit of taking them. Really, especially in the 5 to 11 trial data, there were very, very few serious adverse events and a lot of positives to come from it. So it's okay for parents to be worried, but it's also necessary that they talk to people who do this for a living, who study this, trusted outlets, and find out the facts about what's going on with the vaccines. And then the facts are is that they're very, very safe. And they're going to really prevent a lot of kids from getting sick, from dying, and from transmitting COVID to those around them.
I will second all that. So what's Norton's plan for offering the vaccine? Are all pediatric practices going to be having it? And when do you expect them to be able to do that?
Yeah, so Norton's going to have a bunch of opportunities to give the vaccine to children. You can go to nortonchildrens.com to find out the actual locations. But there's locations in St. Matthews and on West Broadway and in Dixie. So there's going to be a number of places where people can get the vaccine, and it should be pretty convenient for a lot of people to get it through Norton Children's. And it's important. So if parents are worried about whether they should do it or not, whether they should get their kids immunized, well, talk to your pediatrician, and I'm pretty sure that pediatrician will tell you it's a good idea. This is really important for everyone.
Well, thank you. And I know that if anyone's worried, I know I asked my kids' pediatrician when we were there a couple weeks ago for their well child check, and they will be having like COVID clinics. And so if you guys have questions, make sure to schedule an appointment to talk that through with your kid's pediatrician. It's going to be great to have a bigger percentage of our population vaccinated, and hoping that this will prevent us from the case counts going back up like we're seeing in Europe right now. So timing is good, and I am looking forward to that. Dr. Jett, welcome back to Louisville. I know it's new CEO of Park Duval. We're glad you're back here. And same question to you. Will Park Duval be offering the pediatric Pfizer vaccine, and what clinics, and what are you looking most forward to with having this?
Well, first, thank you for having me, and I'm glad to be back. I would just caution, parents, over the last year and a half, I've been on the ground as an epidemiologist and seeing a lot of patients. And even in my own family, my 2- and 4-year-old contracted COVID. And I wish it was a vaccine for them, because I saw the symptoms last for almost a month. One of my kids was still sluggish and had a cough. So I really didn't anticipate that. My wife seemed to recover within a week. Contrary to what the study showed, we really didn't believe that kids can have lingering effects of COVID. But we just don't know. And so, with that word of caution, I would encourage parents to make sure to get their kids vaccinated when they become eligible. In terms of Park Duval, we intend to offer it at 2 school sites, Central and PRP, but it's only for family of the students and the faculty there at that site. Now, at our regular sites, we're offered at Russell, the main site, and in Spencer County. So as soon as the vaccine is available, we intend to make sure we can inoculate as many people as we can.
Thank you. Sorry, I was having muting problems there for a while. Yeah, so just a great reminder that no matter where you get medical care right now, they probably are offering the pediatric dose once it does become available. Any concerns you're hearing from parents, Dr. Jett, and anything you want to make sure, any words you want to get out to the public?
Well, I have heard concerns, as I have throughout the pandemic, that this was manufactured too fast. We didn't do enough testing. And, we have some old cliches. It's often better to take the preventive measure and to ensure that your kids are vaccinated, and family members as well, then actually have to contract the disease. Anytime we can prevent somebody being hospitalized, being on a ventilator, being intubated, it is key for us to be in the prevention mode to ensure that we're saving lives. And anything that we can do to continue to be a partner with the health department and be on the front lines, we're willing to do that. And, give the right messages to the community that vaccination is important and it is critical for us to move out of the pandemic.
Well, thank you, Dr. Jett, and thank you for Park Duval being a great partner for us this last year and a half with making sure that everyone in our community has access to testing as well as vaccination, and doing lots of pop-up clinics throughout the community as well.
Thank you.
So before we end today, I'm going to turn it over to my Deputy Director, Connie Mendel, to give us an update of the Say Yes to Test for COVID. We launched this initiative on October 12th and have a few weeks left. The National Institutes of Health, NIH, gave us a great opportunity to offer free rapid home COVID tests to people living in several specific zip codes of Louisville. And we know these zip codes were selected because they have residents there who have experienced a higher burden of disease from COVID, and they're also areas with our lowest vaccination rates. So people can get up to 8 tests by requesting them online through our COVID helpline at 912-8598, or by picking them up at one of our partner locations. Connie, how's this been going since we launched, and how many test kits have we distributed so far?
So it's going really well. We're really excited. So far, nearly 50,000 kits have been ordered and distributed to households by mail, and over 27,000 kits have been delivered to our community partners, and they've been handing those out.
And remind me, how many kits or how many tests are in each kit?
So there's 2 tests in a kit, and households receive 8 tests or 4 kits by mail, or pick up that same number. So each household receives 8 COVID tests.
So that's great. So I know we have 1 million tests to give out and just a few weeks left. So just encouraging everyone to make sure that they access test kits from one of those 3 ways. Mm-hmm. How much longer are we able to do this for?
So Friday, November the 5th, will be the last day for any community partners to order additional test kits, and then November the 12th, at the end of the day, midnight, will be when the online ordering ends. So you can order the kits through November the 12th online. So we now have over 77 partners in the community. So we had a big jump, and a lot of people reach out to us And most of those are open to the public to pick up the kits. And several of those have increased the size of their order just based on how quickly they handed those out. They went through their inventory. Many of our free public libraries and Metro Park centers and several faith-based organizations are open to the public to pick up, again, 8 tests, or what we say is 4 kits. So here's our website, and you can see many of the locations where anyone in the community can go and pick up the free at-home COVID test kits.
Thank you. And the reminder, this is a program where we're looking to screen people who we don't think have COVID. So asking people to test twice a week, enter their information into the app. If they do test positive, what should people do if they test positive, Connie?
So the first thing we do is consider yourself positive. You have COVID, or if it's any family member that's positive, you're able to spread that to others. So we want you to safely isolate from others. Contact your healthcare professional. You can also call our helpline at 912-8598, and particularly if you need assistance with food, medication, other essential items to help you isolate, to keep you from the stores and that. And we even have housing available to those that are unable to isolate from their family members or household members. So everything, you want to do everything you can to prevent the spread of the disease in the community.
And then if they do test positive, asking them to go to their healthcare provider or one of our community testing sites to get tested again, so that test then flows through our system, and we can just make sure that they've got great connection either to our helpline or their doctor to know what to do. Correct?
Yeah. Yes. And again, I want to encourage everyone that lives in our focus zip codes to go online and order those, or others to go to the those sites where the kits are available. And thinking about the holidays and Thanksgiving, it would be great for you to be testing regularly to make those decisions of whether or not to travel for the holidays or join particularly large family gatherings for Thanksgiving.
Yeah, so we've learned a lot about COVID in the last 2 years, and this is one thing that we know is if we do a lot of testing and can find COVID quickly or prevent people from gathering if they know they're positive, we can prevent a lot of spread of the disease and save a lot of lives. So testing along with our vaccination and our masks, and then spacing and distance, if you're not able to do any of those, are all really, really important. So I guess before I close out, just remind everyone with all the holidays coming up, make sure you're vaccinated, testing before you go, wear your mask if you can, and just happy to be in a new place than we were last year with a lot less fear and a lot more knowledge going into our holiday seasons.